Hi there, my name is Kate, and about 7 weeks ago today, I had bilateral knee surgery, which is basically a full knee replacement. But I didn't have it on just one, I had it on both knees. And the reason I am making this video is because I found during the recovery, and even beforehand, there was not a lot of information on the stages of recovery and what to expect when you have both knees done. Lots of information on one knee, but not a lot of information on two. So I hope you enjoy this video, and hopefully it will give you some food for thought, things to ask your surgeon, and maybe just know that you're not alone in some of the things you're thinking and feeling. So as I said in my introduction, this is week 7, and I walked on with my walker in the original introduction, but I can walk without the walker for short distances, which is nice, so I can finally get around to my kitchen, makes it stand up, go from sink to counter, or walk to the bathroom without having to use the walker all the time. Big improvement. But for anything longer than that, and I live in a small apartment, I do need the walker.
These are some before shots of my knees. You can see that I'm bone on bone.
So one of the big things that you have to do after your surgery is learn how to rebend your knees. When I first got out of surgery, I couldn't bend them at all. And then slowly I've got to about a 90-degree angle, maybe a little bit more at 7 weeks. And eventually they want me to get to at least 110 degrees, and I'd like to get more. So I want to show you an example of where my legs were at the first day of surgery to where they are now. I couldn't move them. They pretty much stayed like that. I could maybe do this. So I was doing a lot of propping up out of my chair with my arms. You need a lot of arm strength. Now I can go to about there on my own. And if I use my knee, I can get even more of a bend. So about the pain, there is pain. The minute I got out of surgery, I noticed that I had no more arthritis pain, which was amazing. What a big difference. But that's where I get all the pain from the muscles next. There's a lot of muscle pain. I had, felt like a tear underneath my one knee, and I have a groin pull that is still bothering me 7 weeks in. So I took the hydromorphone probably for like I had 3 cycles of it. So maybe 3 weeks almost. And then I'd weaned myself off. They gave me 1 pill or half pill to take each day. I took the 1 pill for the first day, and then the next morning I was not liking the feeling of it. So I went down to half pill when I was up during the day and a full pill at night. And then slowly got into the half pills, and then nothing during the day and just some at night, and then finally take it off. I take the Tylenol every day. I still take it at night now. I'm finding I'm still having a lot of problems at night. Sort of when I go to bed and then my legs sort of stiffen up, the circulation doesn't going, they sometimes roll over and they pull. So I do take the Tylenol at night, but not so much during the day. Depends if I've overworked my knee. If the first one day, then on the next day, I will take maybe an 8-hour Tylenol, arthritis, and then I'll take some at night. The pain, I didn't find that bad. I find it more annoying. I find it a bit distressing, frustrating. There are days that I have cried, mostly at night. I would cry, I feel like it was more of a frustration than the actual pain, but definitely more of a dull, achy pain. But occasionally there's this burning sort of red pain that comes in a certain place where you've bent differently. Overall though, from the arthritis pain that I had constantly all day, this is a lot better. I will say that there's a lot of muscle aches. My elbow for a long time because of using the walker would hurt. My lower back sometimes gets really upset at me because I'm sitting in the bed for a long period of time. So at 7 weeks, I'm on just Tylenol, and at night is mostly the time where there's more pain. But again, it's different pain from the arthritis pain, which was like dull and achy and sort of hurt all the way up and down my system, whereas this tends to stay in the knees, except for there's some spot locations where it's just because I was overworking, walking with a walker or pushing myself up. All pain is different. I hope that you have a situation where I had, that it's not as horrible for you as it may seem. I had a colleague who had double knee surgery before he went in, and he went, the pain was the worst. He said he couldn't take the pain, and all he really talked about was the pain that I was gonna have. So I'd like to balance that out with the pain was manageable. Yeah, I needed the hydromorphone for the first few weeks. They only gave me 5 days to begin with, and yeah, that wasn't enough. Definitely needed 3 weeks. But otherwise, I didn't need full tablets all day long, which was good, just the little halves. And then I got off it as quickly as I can because I know how addictive that type of thing is, and I just didn't want to deal with that. I'd rather have some pain and deal with Tylenol than have no pain and get addicted to something I don't want to get addicted to. So I was mentioning that there was not a lot of information for you. With one knee, they sort of say the recovery is about 6 weeks. You should be able to start to go to work and drive and things like that. No way I'd be able to do any of that right now. I will try to do some work in the end of next month. Because hopefully I'll be able to sit for longer periods of time. As far as getting in the car, I have a small Toyota. There's no way I could lower myself in and out of that. So the time frames for the one knee very different from the time frames for 2 knees. I watched a couple YouTube videos, as I said. One was a girl who's like, I looked up the research, I talked to everybody, and she pulls away her she's sitting on a couch and she pulls away her blanket, and the 2 knees are still wrapped up and she can't move them at all. So that is an expectation. You're not going to be able to really move your knees. You're going to need the grip bars to do that. So I wanted to talk about sleeping. At the beginning, you're sleeping a lot, which is normal. Now, at about 7 weeks, I'm still having a huge amount of difficulties with my sleep cycle. I'm normally a day person, and I try to go to bed, around 11 or 12 each day, but I can't. I sleep maybe for a few minutes and then I wake up. My legs get crampy, I'm uncomfortable, sort of any stress that I gave them in a day are achy at night. I might have to get up and get some ice or some Tylenol. Usually it takes me a while to settle again. And then it's like 3, 4, even 6:30 sometimes in the morning. I do get sleep. I tend to sleep sort of from the wee hours in the morning till about 11 or 12 during the day. So it may not happen to you, but definitely had to mention that issue for me. It's kind of annoying. So hopefully your sleep cycle will be good. So I just wanted to talk about the first 10 days of after your surgery, when you come home, and sort of what happens in the first few days of being home. So I was released from the hospital and I was able to stand and walk a little bit. So I went down to the car, and it was an SUV, and it was a little difficult to get into, I have to say, when you can't bend your legs. Make sure that you put the seat all the way back. It was first thing for that. The ride was a little rough with all the little bumps. My brother who drove me was aware of that, of a pain like that, so he was very careful. I got home and he went to get my medicine, and I was in between medicine when on my way home, and so I was very sore by the time I got here and was definitely waiting for my next dose of hydromorphone. Once I had that and I just sort of went to sleep, I got up for a little bit of food and then went back to sleep again. My brother was watching TV in the other room, and I couldn't watch TV myself. I just sort of listened to what he had going on, and dozed in and out. After a couple of days, I was feeling a little better. I could get up and get some food. And I was playing a little bit too much Candy Crush, and again, sleeping and a lot of that sort of thing, not doing too much. So by about the 10th day, you have to go get your staples out, 10 to 14 days. So I had an appointment to get my staples out at 10 days. I had 30 staples in one and 32 in the other. And I got them out. It wasn't too bad. It felt like a little pinch or a little pinprick. One was really stubborn, and that did make me go, ooh. But generally, it's not bad at all. Nothing to worry about. Once I got home from that, the physio person called me, and I was now into my recovery in full, where they had to really work at bending my knee. So it was mainly just sleeping, taking it easy. So do that yourself. Make sure you take it easy on yourself. So my surgery was in Canada at a place that does day surgery. Usually that's good for one knee, but they did both knees. The recommended time for a single knee is 1 day. Usually they get you up and out. And with two knees, usually it's 2 to 4 days. Before you go in, they ask you what you need to get home into your apartment. I didn't need stairs. I just needed to be able to walk a certain distance and use the washroom by myself, because it was my brother who was coming to take care of me, and I needed to be discreet. So they came in the morning of the next day after my surgery, and they made me walk down the hall and walk back. And I have been going to the washroom on my own from that time. So they sent me home 20 hours after I went in. Probably wouldn't recommend this. If you can get respite care, that would be really the best thing. Respite care for at least a week or two. Or if you have somebody who's able to really take care of you at home. I didn't. My brother stayed for 2 days, and then there was a big snowstorm, so I sent him home. He stayed long enough to make sure I wasn't going to fall on my ass. And then from there, I was on my own. Probably helped in the recovery, because I had to get my meals. I had to, pick up things from the ground that I dropped, all kinds of things like that. Get in and out of bed a lot more. So my recovery, probably I'm happy that I got moving a little earlier than most, but would recommend highly that you go to respite care. So this is my setup where I've been spending, I'd say, at least the first 2 weeks, 90% of my time. Now I'd say I spend about 30 to 40% of my time out in the living room, and then maybe another 60% of my time still in bed. My couch is the type of couch that's really deep. I can't get in and out of it by myself. There's not enough arm holds, and it's uncomfortable for me. If you had a nice recliner, that would probably be the best thing. Then you could sit out with your family. I don't have any family. I'm on my own, so I just hang out in my bedroom. So about bathing, this is fun. They recommend to get a bath transfer chair. I got one, but the way I set up, it was in my bathroom. There was no way I could use it. It was tilted. It was too big. My toilet is right beside my bathtub, so I couldn't get into it with the frame I have around my toilet. And yes, I got a frame for my toilet, not a commode. I don't like commodes. I think they raise me up too high, and I just hate them. So I got a frame, and I find that worked really well. I also got the frame for my bed, which was really good too. Anyway, so I learned how to scissor into the bathtub, holding on to my walker. Eventually I got bars put in my bathtub, which I could recommend for everybody to get the bars put in. Standing in the shower, I could stand a few minutes, but I do find that the back of my calves and my upper knees get really, really tight. And so as the weeks go on, I can have a longer and longer shower. But the first couple showers were difficult. Yes, now you want to know about going to the bathroom. It was interesting. I watched a couple YouTube videos before my surgery, and one guy was walking around his backyard, and he also mentioned that he didn't get up some of the times to go to the bathroom because he found it kind of tiring, annoying. So unlike him, as a woman, I needed to get up and go to the bathroom. I chose to get a frame instead of a commode. It is a little bit more arm work because you have to lower yourself down a little bit, but no problems there. So some of the things I did do to prepare was I read about single knee surgery. I did watch a YouTube video of it, what they do to your knee. Probably not recommended. At least the nurse was like, oh, how could you do that? And a couple of things that got me when I was first doing surgery. It's like, yeah, I'm having 2 knees done. And everybody's like, wow, you're brave. So that was to make me really happy. There was a gentleman who worked with me and he had both knees done. He said the pain was excruciating and he thought it was crazy to be able to be going home all by myself and trying to deal with it. Probably was. I would recommend if you have somebody or you have respite care, that would be the better of the plans. And then another video, or a couple videos I watched, the other lady, she was like, I am I'm in shape. I followed up with this guy who did surgery. Everything was great. And then she's sitting on a couch and she removes her blanket and you see the 2 legs and she can't move them at all. So that's part of the course. Your legs are going to be really difficult to move. You can't roll over at night when you're trying to sleep. Definitely needed the grab bars on my bed to try to haul myself up, at least so I could get up into a sitting position to get up and walk around. So the first couple of weeks, don't expect a lot of movement, but it gets better every day. And as I said, I'm really happy I got it done. The pain from my arthritis is gone completely. Now I know that the pain that I'm dealing with now is just recovery time. So well worth it in the end, I hope. Thanks for watching this video. I hope you found some useful information that will help you going forward. And I wish you luck in your surgery. Or if you've already had surgery, I wish you luck in your recovery.